The Arkansas Department of Human Services is a place where we tackle big social issues with compassion, courage, integrity, and action. The work we do matters to people in every community, large and small, in this great state. In 2018, DHS employees and the leadership team focused their efforts on serving fellow Arkansans and putting programs and changes in place to build a stronger foundation for the agency so the critical services we provide will be available for decades to come.
It's extremely important that we take a few minutes and look back. There's so much work that's going on and there's so much work ahead, but it's when you stop and look and go, look where we've come, look what we've done, that it not just gives you the energy to keep going, but it makes you realize that the team at DHS is doing amazing things.
Over the last 12 months, employees have made changes that help make programs more fiscally responsible and innovations that serve as models for other states, all focused on fundamental policies to help improve our workforce and better engage clients and their families. As we prepare for the work to be done in 2019, we take a moment to look back at our accomplishments and just how far we've come since January 2018. We kicked off 2018 with an announcement from Governor Hutchinson explaining Medicaid transformation and accuracy efforts had reaped millions in savings that had big implications for DHS and the state budget.
DHS is now projecting that it will spend roughly $500 million less on Medicaid in FY19 than was anticipated last year having to be spent on our Medicaid program.
But we weren't just focusing on numbers. The people we serve were at the center of our efforts. In February, DYS hosted the first ever all-facility basketball tournament, incorporating athletics and skill-building activities into the teens' rehabilitation programs. Good grades and good behavior earned students the opportunity for friendly competition, including a pickup match with Governor Hutchinson.
And it's about helping people to rise out of poverty and to achieve the American dream.
March finally brought the approval of the new Arkansas Works Work and Community Engagement requirement, which we'd spent months preparing for. Arkansas, the first state in the country to execute this type of effort to help people climb the economic ladder.
And it's easy to just hand people a health insurance card, but it's a much harder task to help them make the changes to move out of the Medicaid program and hopefully to a better life.
Dozens of Division of Children and Family Services staff team members put in the miles to walk for the waiting, raising funds for children in our foster care system to help support our community partners, raising more than $17,000.
It's time the Department of Human Services is reporting zero growth when it comes to the state's Medicaid program. The spending has also decreased by millions since last year.
In April, we also rolled out our quarterly Medicaid scorecard, which measures how much we're saving by transforming several aspects of the Medicaid program. We saw significant savings that by August proved to show zero growth for the first time in modern Medicaid's history in Arkansas.
Of Human Services filing lawsuits to temporarily take over 2 nursing homes.
And we can't forget that over the past year, the Division of Provider Services and Quality Assurance had to contend with significant challenges. DHS took 2 Skyline nursing home facilities into receivership, requiring Office of Chief Counsel attorneys to drive across the state and file emergency paperwork to protect patients' health and safety. DIPSQA continued to monitor conditions in those facilities for months.
You're looking to work. Okay.
In June, we became the first state in the nation to implement a work and community engagement requirement with massive outreach efforts and coordination across divisions, offices, state agencies, and other partners. The Division of Services for the Blind continued its Jumpstart program. It gives young people who are blind or visually impaired an opportunity to interact with peers, step outside their comfort zone, and experience their first jobs.
March. Is it this class, this one?
We realigned our early education services for children with developmental disabilities paid for by Medicaid to create the Early Intervention Day Treatment Program. It required providers to meet children's medical and education needs if we were going to have Medicaid dollars paying the bill, while also offering families more options. All the while, behavioral health and DDS staff worked with vendors and providers to complete more than 30,000 independent assessments to set clients up for success under the new PASS framework for behavioral and developmental disability health services. RSPMI was put to rest, and outpatient behavioral health services expanded beneficiary options for covered counseling services, and it allows primary care providers to offer medication management. The Division of Provider Services and Quality Assurance certified more than 100 current providers to transition them to the new behavioral health framework by the deadline. It all went to create a system of mental health and substance abuse treatment with more covered services and more access for Arkansans across the state. As we transformed our programs, we saw a need to find objective ways to measure our success across divisions. That meant mapping our processes, tackling problem areas, and tracking our work using dashboards. We've begun work on performance with positive results already, like the elimination of an adult protective services case backlog that had been building for years, and will continue to build on that foundation in the year ahead.
So even when the results are scary or don't look good or show that we're not doing a great job, it feels good to own that and then fix it.
An additional $26 million in funding from the federal government has helped the Division of Child Care and Early Childhood Education eliminate a backlog of over 1,000 families waiting for child care assistance, making critical care and early education more available and affordable for hardworking parents. DCFS, after working for the past 2 years to stabilize and reform operations in our foster care system, saw that hard work and investment pay off. The division is bending the curve on caseloads, and we've seen 600 fewer children come into care in the past fiscal year. Overdue investigations are decreasing, while more siblings are being placed together in foster families. For those children who need a forever home, they're finding families sooner.
We finalized over 1,008 adoptions in state fiscal year 2018, and that's a huge increase, more than 288 adoptions from 2016. So we've seen giant increases, and really that's because we put a focus on it and staff worked really hard.
The Division of County Operations launched a new EBT vendor without hiccups.
So welcome to our second Let's Talk Integrity and Ethics.
And we as an agency began conversations about what integrity and ethics mean inside our organization, setting the expectation that integrity is part of our culture. If that's not enough, we've rounded out the year with construction of the Blue Umbrella, a new store in our main office where crafters and creators with developmental disabilities can sell their wares and earn incomes to help them be more independent. We invested in major technological upgrades to our large conference rooms, bringing our chief meeting space into the 21st century. It also lets us connect with our county offices all across the state in real time, an important effort to truly be one DHS.
We also need to look at adding the new logo to the welcome letter, the checklist, the We Act.
With that in mind, we've kicked off a new employee onboarding and an orientation process that streamlines a new team member's first days and introduces them to our agency. And Central DHS office staff hosted the 3rd annual trick-or-treating event for children in foster care, employees' children, and others we serve.
So today I want to announce a series of measures that we're going to implement that's going to strengthen our juvenile justice system.
As we prepared for the end of the year, DYS staff was also working hard on transforming the youth services system as part of a larger effort around juvenile justice reform, including closing 2 facilities. The DYS youth also pitched in on an agency-wide project, teaching several employees how to knit hats while making dozens themselves. Hundreds of hats and scarves were donated to the Arkansas Homeless Coalition. It's been a year of change and big projects, all in an effort to build a better agency and make DHS a place where we live out our motto: we care, we act, and we change lives.